I want to start off really quick talking about one of the vaccinators at Stanislaus State, and it's specifically something she had told us uh, just a few days ago. So she told us that on one of the days she was vaccinated, and she's vaccinated, she's a mother of four, balancing clinical studies. She rushes the front lines to help people. She's helped 150 so far. One of those people told her that she had not been outside of her house since February of 2020 because she was a primary caregiver. She was over the age of 65, and the risk was too great. And she was absolutely terrified of getting this vaccine, partially because there were some unknowns about it for her, but she wanted this vaccine. So she showed up, and once she got the vaccine, she broke down in tears because she realized this is the beginning of the end. Mm-hmm. In a good way.
Yeah.
We asked these people to stay home for almost a year now. And that right there, I think just reminds us of what everyone in Stanislaus County is playing for and what all the sacrifices have been about so far. What's your response to stories like these?
Yeah, so it's, I think you're right. She's right. It's kind of that idea of this is the beginning of the end, and that will still take some time. We heard a very similar story of a lady that fell into that age category and had, I want to say it was two grandchildren that had been born since COVID started, and she had not seen or held either one of them. And so she was just ecstatic that now that with the vaccine, she could, once her immunity built up, go see her new grandchildren. And, that is one of the reasons why here in Stanislaus County for vaccines specifically, we have pushed so hard to get it out there because we realize there are, thousands of people in our community who have done, the right thing. They've done what they can to slow the spread, but everything that we have done up until the vaccine is only about slowing the spread so that we can have enough hospital capacity, specifically the ICU capacity, to treat people throughout this last almost a year now. But the vaccine is exactly that. It's the beginning of the end. It's how we're going to, stop this ultimately. And so we have prepared and planned for, this mass vaccination push. And quite frankly, we're very pleased with the outcome so that these kind of folks, whether they're elderly, and have, been afraid to go out because, the high impact of COVID-19 on that population, or our ag workers who are kind of coming up next, our educators, right? So we can get our schools back open. We are doing everything that we can to get that vaccine into people's arms.
On that note, a big part of that is the second dose. That's where we get bumped up to 94, 95% efficiency against the virus. Now, the big thing I've noticed so far is that there was a quite dramatic change to the schedule for those vaccinations. Not a whole lot of first doses this week, hardly any actually.
Yep.
Can you walk us through what exactly is going on with that second dose right now?
Yeah, so the short one thing that had a major impact on our ability to give first doses is a few weeks back, we got an allocation of 4,000, I think they were Moderna doses from the state. And they had been somewhere unused. So we got this kind of one-off allocation. Well, the problem is that one-off allocation of 4,000 doses didn't come with a second dose guarantee. So what has slowed down our first dose deliveries is we have had to hold 4,000 doses to prepare for second doses, right? To kind of fill up that gap. Because typically what happens if we get a first dose allocation, there is a second dose allocation behind it. That didn't happen in this particular instance. So that has dramatically reduced our ability to give first doses. And right now we're getting out mostly those second doses. Tomorrow, we expect to give over 3,000 second doses between our clinics across the county. And that does not count all of our healthcare partners. So that's why in the last week or 10 days, you've really seen a slowdown in first doses. This all comes down to vaccine supply. We're not getting enough. One of our frustrations here in Stanislaus County, and quite frankly, I think I can speak for many locales, many other counties across the state, it's the vaccine supply. And I know that there's challenges nationwide with that, right? They're getting it out as fast as they can. But where we see a lot of energy being spent is on, the state or even the federal government. Oh, we're going to open up these mass vaccine clinics. There's one scheduled for down in Fresno. And we actually look at that and say that is very counterproductive to our effort, because that clinic is going to get a large allocation for it. We can vaccinate 35 to 40,000 people a week in Stanislaus County. I'm talking like first doses, right? That can be our throughput, and that includes everyone. If you look at just our county clinics, the 4 clinics, um, we can conservatively do 3,000 a day times 7 days a week. That's 21,000 doses. You can functionally double that with all of our healthcare partners that have joined with us and qualified to give doses. So, so far um, we have kind of under promised and over delivered. And that is really one of the mantras that we're living by, right? So we are very confident in our ability to do that. We need the state to give us those doses. We don't need them to help us develop clinics. We just need the vaccine.
So in regard to that second dose and the availability of the first dose, next week, are we anticipating to see a more normalized schedule or more balanced schedule of first and second doses? How long is this going to take?
Yeah, we should. We should, because like I said, we had to kind of make up for that 4,000 first doses that didn't come with a second dose. But no, that should largely be done ideally by the end of this week, might be next week. But we should return to a more normalized schedule of first and second doses moving forward. But right now we're only getting about 5,000, new doses, first doses a week. And that is just one of our major challenges. We can do 7 or 8 times that amount.
I think this is a good opportunity to ask you about the goal 0 by Friday.
Yep.
Pretty ambitious. Some of that is kind of out of your control, getting people to the vaccine site. How exactly has that gone for you guys?
It has gone well. I actually just asked this question to the team this morning, and they said we are sticking to that very well. We're not perfect, right? I make no bones about that, but we are overwhelmingly using every first dose every week, other than this issue of having to hold some for second doses, given the availability. Those we do hold because we have to, but when it comes to all of the first doses, we are getting, I can't really give you a percentage, but I'm going to say 95 plus are out every week. And the team, our vaccine team has just done incredible work of, we issue, say, 500 to one of our partners. We follow up with them every day throughout the week and make sure, hey, have you been able to use them? If you can't use them, we'll reallocate them elsewhere in the county so that we get those shots into people's arms as fast as we possibly can.
And speaking of getting shots into people's arms, one of the ways you guys started doing that was the mobile vaccine clinic.
Yes.
That is a pretty interesting effort. I've heard some counties taking similar approaches.
Mm-hmm.
Before we start talking about it, can you break down what exactly this is, other than just a clinic that is mobile?
Yeah. So it's a team that goes out to, we've identified several spots throughout the county where we intend to do this. The one that we did this week on Monday was a pilot project, right? So that we could kind of test our proof of our concept, make sure that it was valid, figure out how we need to scale up, scale down, need a different piece of equipment, whatever the case may be. And this one we did in West Modesto at the King Kennedy Center, the West Modesto Community Collaborative. We chose that spot specifically. This idea of health equity is very important. And we realize that there are some folks that they have to work, maybe they lack transportation, whatever the case may be. So our intention is to go to them so that they have that opportunity to get the vaccine as well. We had targeted for Monday 200 doses with that clinic. We had the capacity to do that. Unfortunately, we only gave out 84. And so we've identified a couple of issues with that. One is a certain vaccine hesitancy amongst the public. And we're trying to dig into that a little bit deeper and determine if that was just unique to that community? Is that, the broad public thing? Because, we're not seeing that at our other clinics. It's kind of the lines are long. Um, Another factor that came into play is that was a fairly um, short notice announcement from when we put out that we were going to do that until we did it. And so that messaging, that marketing of that, we probably have some work to do there. And we're evaluating all of that, which is why we did a pilot, so that we kind of know where the strengths and weaknesses are. And by this afternoon, maybe you can hear all my emails chiming in today, but we are going to get the location of all of the other spots across the county where we intend to do mobile clinics. Uh, and the issue is vaccine availability, right? Again, I'm going to probably say it 10 more times during our time together, but if we can get more vaccines, we can get them into the people's arms within the week. And so that is our number one hang up with doing more of these mobile clinics.
So let me tell you a little bit about what popped into my head when I heard about vaccine hesitancy and the mobile clinic. If these clinics are designed to go out into communities that maybe are underserved, maybe don't have the access to it, I can imagine those being, I think I've heard the healthy quartiles index, healthy places index in the lower quartiles,
Yep.
places that where you might see more vaccine hesitancy.
Mm-hmm.
Well, if we're targeting these specific places, and we already know that there might be more vaccine hesitancy just due to demographics or geographics, whatever have you, how exactly is that a riddle that we can solve?
Well, a lot of it comes down to messaging. We have had some good products out there about the safety and the efficacy of the vaccine itself. But part of what we're evaluating is, are they going out via the modes that the people in those communities might use, right? We're doing a lot on social media because there's a lot of folks, let's face it, a lot of folks are on social media regardless of a demographic. But are we on the right channels? Have we correctly had things translated or interpreted so that they can be understood? And quite frankly, like on this one, were they given enough notice to know that it was even an opportunity for them? And one area where we can really use the help is from anyone that, say, watches this. If you participated in one of our clinics, you went to your own healthcare provider, you went to the mobile clinic, tell your friends, hey, it's safe. We got through it. We do recognize that sometimes, like with our bigger clinics, it is what I refer to as individually inefficient, right? You have to go stand in line. But when you look at getting a mass population from kind of the systemic standpoint, it is one of the most efficient ways for us to deliver those services to the largest number of people possible. So, but saying all that, we need the people that have been vaccinated spread the word. Here's the websites, here's the social media, here are the platforms where the information is out there, and go get the vaccine.
On that note of people going to get the vaccine, I think if there was ever a single question on people's minds, for most people, I think, it's the prime question: when is it my turn?
Mm-hmm.
You guys were kind of hot out the gate with 65 plus.
Yep.
Now we're hearing, I think Nevada County vaccinated 1,400 teachers. Sacramento County is planning to vaccinate some of their teachers later in the month. So where exactly are we? When can we start expecting to vaccinate our teachers, if at all?
Yeah. So the two big categories that the state has allowed us to move to, but they're not supplying the vaccines for, are agricultural workers and educators. Those are the two big categories. And in our county, that is thousands upon thousands of people that fall into those two categories. And yet the challenge is we still receive our vaccine allocation based on our 65 and over population, which means we aren't getting enough vaccine for the county to move into those categories. Now, we do expect that within the next week or two, we are absolutely going to get there, but either we slow down with getting our 65 and older population completed by taking some of our allocation and giving it to either educators or ag workers, or right, we try to knock out the 65 and older population. So our vaccine team is doing a lot of evaluation right now as to when we think it's appropriate to make that transition. But I would expect that within the next week or two, we're going to be there. We need more vaccine from the state, and we will get to it. We have the capacity to do it. We just have to have more vaccine.
All right, we're up to 4 now, 6 more to go. So I heard some conversation that the schools might be opening up in mid-March. Do we know anything about that conversation right now?
The conversation is out there. My understanding, I have not spoken to any of the school districts personally. My understanding is that we have broad commitment that they want to reopen by, I think it's March 15th, but mid-March. Again, as long as we can get the vaccine and help them get there safely. Obviously, they have concerns about their students, about their staff, and we want to enable them to do that. 5th time, we just need the vaccines to do it.
So for my last question here, it's about the future of first come, first serve. When I last spoke to Kamlesh, she was talking about how there are some other ideas coming in, or at least being discussed. What's the future of this first come, first serve walk-in model in Stanislaus County? How long is this the way for the foreseeable future?
Well, so the state has released a new app, the name of which escapes me at the moment, but where people can go, download the app, go onto it. It will identify for them places where they can go, whether it's a county clinic, whatever of our medical providers provide the vaccine, and they can potentially schedule directly through that. We believe that this will be a very useful app for us to allow just that scheduling of appointments. The concern that we have is that it's a piece of tech, and so far in this process, a lot of our technology has not worked that well. What we don't want to do is slow down the process of getting vaccine into people's arms, again, with that kind of individually inefficient method, but kind of systemically efficient by transitioning to a different process. Because if we do that and it slows it down, we view that as being counterproductive, though for that individual, we do acknowledge it's easier for them to have an appointment. So by way of answer, I can't give you a specific timeline as to when we expect to implement that. I think my turn app, I believe is what it is. I can't give you a specific date of us expecting to implement that. Just because we don't want to slow down the process.